You know, the interesting thing to me, and as a sports medicine physician, I was right there in the midst with everyone of conventional medicine. How do we treat pain? What do we do? Well, first we try to, obtain an accurate diagnosis, but it really ends up being the same treatment for everyone. We try anti-inflammatory medicines, ice, physical therapy, rest, exercise, and medications. And beyond that, that's about it, and you would get to a point there and say, well, maybe you're a candidate for surgery. Let's send you to see what the orthopedist says. And when you send someone to a surgeon, you usually get a surgical answer. And so those that would rather do something natural, healing, utilizing their own tissues to help resolve a problem, there's a big difference. There are a lot of things we do. We do peptide therapy to decrease inflammation, hormone therapy, testosterone therapy decreases inflammation, growth hormone. There are many things that we can do to help improve levels of inflammation, and then specific joint and musculoskeletal injuries. I just completed an all-day training Saturday with StemWave. I was in Tucson for the day with Gerald Morris, brilliant guy, really neat integrative medicine MD, and who speaks for this company. And I've been looking at a Shockwave device for 10 years. And StemWave has been around 2 or 3 years in the US. And there's a big difference between their Shockwave and those others that are on the marketplace, which they do work, but they're kind of it's like using a shotgun, to fix an ankle sprain. And so the StemWave device is the only focused electrohydraulic shockwave device in the world, and it is pinpoint accuracy. And so being able to take that shock wave, which is produced in the transducer, the handheld portion of this machine, and it travels at 3,300 miles an hour. So it creates a real shock that goes in a focal area to the tissue and targets inflammation, causes stem cell recruitment. It breaks down trigger points, fibrosis, scar tissue. I was really amazed with it. And there were 10 or 12 physicians from around the country there. We all practiced on each other all day. And my neck that's been killing me for days as we're doing it, they kept turning up. They're like, does that hurt? I'm like, no, it actually feels really good. They're like, well, that happens sometimes. So tell us how you feel in 24 to 48 hours. And I haven't awoken with pain in my neck and first rib in the last 3 days since I was there. And I'm like, hey, I can't wait to get that here in the office. And there are a lot of exciting therapies and things that we do outside of conventional medicine. So it'll be real exciting to have the Shockwave device with StemWave here in the office. Again, stem cell therapy, using biologics to harness the power of healing and alleviate some fairly significant injuries to soft tissue, whether it's ligament, cartilage, muscle. There's much, much, much that can be done short of surgery. And in fact, half the people that I see with knee pain come in because they were told they need a joint replacement, and it's over 90% effective. 80 to 90% of the time it's one injection. Occasionally we'll do a second injection 3 to 6 months later, but the average pain relief is around 90%. So if someone was a 7 or 8 and now it's a 1 or 2 and they said, no, I can live with that, I feel so much better, then we're done. And if not, like in my case, I wasn't going to be happy with my knee until it was a 0. And so I did, a couple of injections over the course of a year. I injected my right knee in 2012. It is 13 years ago. It has never bothered me since. Pretty exciting stuff. I ran into a guy at our country club playing golf last week at Aspen Glen that I saw 7 or 8 years ago, and he was in his 30s at that time. I then ended up seeing his mom and his wife because using his stem cells had helped his knee so much. An orthopedist at the time, because he was a very intense snowboarder, wanted to do a partial knee replacement. He's like, man, I'm in my 30s. I don't want to do this again. I gave him one injection of his stem cells, and he came up to me. I almost didn't recognize him. I went, wait, you're Patrick. I remember you. And he has had zero pain in the last 8 years since we did one injection. So it's really rewarding. I mean, that's rare. I've, seen a lot of people over the years that, we had to shrug our shoulders back before I, was educated and with all the techniques of regenerative medicine. So, having an alternative for pain relief is really a big deal for people. And now having the StemWave device to utilize for everything from joint injuries to spine injuries, those previously were people we just had to refer out and hope the best. And that was sad. But now we have a real viable option for everyone. Well, this StemWave and Shockwave therapy is primarily for adults, maybe some older adolescents, late high school age, but I really won't be treating any pediatric patients with this. Not to say that there aren't some that could benefit, but the majority of people we see are dealing with chronic pain. It wasn't a sprain that got better in 2 weeks or 6 weeks. It's something that bothers us in our daily activities enough that we would even think about a surgical option. In my opinion, the final takeaway is you don't have to suffer with pain, particularly if it's become chronic, you've tried everything, nothing's working. Stem cell therapy is a real doable alternative that's safe and legal to use your own stem cells in the United States. You don't have to go out of the country. We're not talking about embryonic stem cells, which is not only, it's just highly irregular, highly illegal, and we don't do that. But you have a lot of new modalities, from adding hormone optimization to peptide therapy to StemWave focused beam shockwave therapy. There's really so many things available for us to utilize to help people really feel their best and then ultimately live better longer. So I just encourage you to reach out to us and make a little investment in yourself and see what we can do.